by the famous Churchill when he was secretary for the colonial secretary. But what then comes out, Honorable Speaker, is the professionals sometimes probably miss out. But what is more important is for them to actually have opportunity to express and also to be listened to. Many times, professionals don't fight out. If they find that systems are done such a way that they don't fight, they let it go. But to that extent, I take it that as a parliament, actually, we have tried, and there's a bill of quality of care that our committee has gone through. That bill is actually coming to the House very soon, and it is on safety and quality of care. But what I'll also say, Mr. Speaker, I've also noticed
don't just deal with quality of care, also deal with the issue, I think Farah or somebody raised, or Junet, continuous training and improvement of skills.
Mr. Speaker,
That's what adds to
Mr. Speaker, all doctors are actually licensed every year, and actually what you have to attain in terms of continuing education every year that
because
they do.
There's some clinics you go to, Dr. Nyikal.
So,
just hold. You find some elderly medic, the only thing that shows is a doctor is the stethoscope. Yes. And nothing else. There's no book, there's no reference material around him, there's no nothing, just giving imaginary prescriptions.
Mr. Speaker,
That bill is so important that being a respected medic, I'm ready to give you time to do much more research to make sure that it's all inclusive in terms of medical.
Thank you very much, because actually we were looking at that bill. We were looking at that bill actually last week, and that bill is going to come here. It is actually, that bill is going to be important, and we may actually say need more time to go into details of that bill, even when it comes to the point of discussion. We'll look at it. But what I'll also advise our colleagues here is that when matters like this occur, there was the issue of the drugs, there's the issue of Honorable Kamket. It is important to actually take the matter up. Like in this particular case, I really would like him to take it up with the Medical Practitioner Dentist Council. He can even actually petition our committee so that we look at it in more details. So when these matters come here and we raise them and leave it there, unless somebody takes it up, we look at these regulatory authorities, Pharmacy and Poisons Board, we look at the Medical Dentist Council, and then we can actually take the matter up. So I agree, there's a lot we need to look at in the health sector. But Honorable Farah also alluded to some issue that even if we look at the working conditions, yeah, even if you look at the working conditions, Mr. Speaker, you realize that until recently, every time we were passing, there were people demonstrating at the gate. We have actually managed as a committee to actually put some money to actually look at their working conditions, their training and so on, and you don't see them anymore. We still have a bit, but we are working on it. There are many structural issues in the health sector. Looking at the issue of the Health Services Commission, the provision in the Health Act 2017, the relationship with the Council of Governors that I agree we need to look at. But our colleagues who have had issues like this, please do not leave it, let it pass. Let us look at the appropriate regulatory authorities and take them to task on what they should do. So definitely there are structural issues and the committee is looking at it, and let us all, but I'll just say one last thing. As members of this House, I've also noticed that there seems to be a higher death rate than we have seen before, but I know a lot of it come from cancers. I think we have the best scheme of service, and I think we should actually take time, virtually every year, to get ourselves screened. Screening is the best, early detection is the best, and those of us who have the opportunity, like members, should take advantage of that. Mr. Speaker, we as a committee will do our best to make sure that in whatever way we can, we improve the services for our people. Thank you.
Kwenya.